Hello and welcome to this week's look at the COVID-19 figures. We're going to start as always with the 7-day rate of positive cases per 100,000 population. And I think the good news is that for the third consecutive week, we've seen a significant fall in the overall prevalence of COVID-19. Greater Manchester down to 37.4 cases, which puts us very much in the amber territory. And although we'll get a few blips here and there, on the table today, 9 out of the 10 districts are in the amber category as well. And a reminder, and we'll see this perhaps more clearly later on, that the lower the numbers get, the easier it is to have small variations from week to week in either direction, and we will see that as we go on, hopefully into the next few weeks, and the numbers continue to come down. If that's good news, let's turn now to the over 60s, because this is, I think, very good news. There you see the Greater Manchester rate for over 60s, and a reminder, these are the people who are most likely to end up in hospital if they contract COVID, most likely to end up in intensive care. So the fact that these numbers have gone down very significantly continues to be good news. Every single one of the Greater Manchester districts now is in green territory, and it's a long time since we've been able to say that. I said that you can get very easy fluctuations in the numbers. If you take Salford as an example, earlier this week Salford was down to 2.1 cases per 100,000. Just a couple of cases there has pushed them back up to 6.2, and that's the sort of fluctuations you get. And this will be reflected later on when we get to care homes as well, that a small number of cases now can change the overall figure quite significantly. But as long as we're in that green territory, that's the place we want to be. If we turn to the heat maps now, and again, this looks like really good news in that we are seeing a decline in every age group, really. Even the working age groups now are coming down significantly pretty much everywhere. We might just be beginning to see the impact of unlocking on April the 12th creeping into some of these figures, but I think what we've seen is that the vast majority of hospitality premises that have reopened, of non-essential retail, it's been really well managed. The people using them almost overwhelmingly are following the guidelines, are following the rules, are keeping themselves and other people safe. So really, for this week, a big thank you for everybody for doing that. And we need to keep doing that so that when we get to the next staging post in the roadmap, we're able to move to the next bit of unlocking. It does depend to a large extent on us and how we behave, but really over the last couple of weeks, well done to everybody involved. Move on to the next slide. Care home residents. Now, again, interpretation of data is everything. And you will see that the number of care home residents with confirmed COVID-19 symptoms as a percentage is the same as it was last week. However, a figure that we're not showing is the number of care homes that have got residents with symptoms, and that is the lowest it's been since we started keeping these records. So again, very small numbers in one place can have an impact on the overall figure, but the total number of homes with residents showing symptoms is now at an all-time low. Clearly, we hope that's going to continue as well, and that the ability to have visitors in care homes gets easier as we go along as well. Let's turn to hospitals now. What's happening with the hospitals? You'll see now in every category there we've had a decline. The total number of beds occupied by COVID patients is probably less than 3% of the overall bed stock in Greater Manchester. Now, some days in ICU we've had 0 admissions, so we're most definitely getting in the right direction. The converse of this is that actually our hospital occupancy is relatively high, and that's relatively high because we are seeing that return to business as usual. We're seeing a return to the recovery, and said previously that a really large backlog has built up over the past 12 months. It is going to take time to clear that, but there are now very clear signs that we are beginning to clear that backlog. And again, a reminder that for everybody who is waiting, they will be contacted by the NHS to be given an update about what they can expect, when they can expect to be seen. I think probably the final thing to say about hospitals is that they've learnt an awful lot over the past 12 months about how to do individual case assessments, how to analyse priorities, not just by an individual hospital basis, but across the whole of Greater Manchester. And the way that the recovery will be driven is to make sure that, as far as possible, wherever you live in Greater Manchester, you see in order of need, not on the basis of the accident of where you happen to live or where your nearest hospital is. Moving then to the last slide, which is the vaccination progress. Again, we're seeing really good numbers. I'm going to comment on the second vaccination. I've done that for the last 2 weeks. A reminder, it's really important that as many people as possible get their second vaccination as soon as they are able to. That 72% figure was 57% a week ago, so that's something like a third increase on the number of people that have now received their second vaccination. We ought to, if we get to 100% on the same schedule as the first vaccination, then it will be around the middle of May. So we've got about 3 weeks, and looking at those figures at the moment, it does seem we're on course for most people to take up their second vaccination. Really important that they do. I know everybody looks at the roadmap and think it's automatic. The roadmap isn't automatic. It does depend on, apart from anything else, on our own actions, and our own actions include getting the vaccines. You see the impact it's already having in the prevalence figures and in the hospital admission figures. We need to keep that going.